Singing River Health System is offering mental health assistance around the clock. Kimberly Henderson joins us with more on the Crisis Intervention Program. Thanks for coming by today here on the 4 o'clock show. And this Crisis Intervention Program, basically it works like an ER. When we think about going to the ER, we have a problem that needs immediate fixing, and this is the same thing with mental health.
Correct. We're open 24 hours a day, 7 days a week for emergency services as well as psychiatric emergencies.
Yeah, what are those emergencies? What are types, just describe, what are these emergencies that you might see?
It could be someone who's depressed, it could be someone who's having a psychotic break, suicidal, homicidal, sometimes dementia with an emergency diagnosis or a medical diagnosis. A lot of those types of things, we see it pretty much daily.
Yeah. And when people come in, what kind of help can they receive if they're dealing with those kind of issues?
Well, they'll come into the emergency department either by private vehicle, or maybe emergency services brings them, or maybe their family member brings them in. It could be voluntary, could be maybe not so voluntary. And they'll come in and see a triage nurse, and they will take a short history, and then they decide where they need to be placed in the department. And then a physician, a medical emergency physician, will see them and make a decision if they are a candidate for crisis intervention care.
And how common is this type of program in other medical facilities?
I don't think it's very common. We're one of the only health systems in the state that provides this type of services.
So why was there the focus on this type of intervention?
Well, because there's just a need. I know that we've seen an uptick in this type of care people have sought out since COVID specifically. You know, the world's in a place that people are just depressed and they don't always know where to turn, and so we're there to try to help them with that.
And have you seen examples of this help potentially saving someone's life?
Yes, absolutely. People will come in that may be suicidal. They'll get the evaluation, and sometimes we might have to put them in the hospital. They might have to go into our psychiatric behavioral health units that we have at Singing River proper in Pascagoula.
How important is it for people, for all people to know, because you never know when you might be dealing with something personally, but also a family member or something, if you recognize something going on, knowing that a service like this is available?
Well, sometimes it's the family that brings them in. Sometimes they don't come in by themselves. Sometimes because of their disease, they can't really see that they need help. They think they're okay. And so the family will start the process. They can bring them in and just give them to us, and we take care of everything from that.
What about a phone number or something to call if someone's having a problem?
Yeah, there's a hotline for the National Suicide Prevention Hotline and Crisis Line. It's 988. But then if you want more information at singingriverhealthsystem.com, you can find more information out about this crisis intervention prevention.
And you have this available at all of your hospitals here locally?
Correct, at Pascagoula, Ocean Springs, and Gulfport.
Okay, well, this is great information, and I think we can all take something from it. And as far as Mental Health Awareness Month goes, what do you think people should just know about it?
Just know that there's nothing to be ashamed of, that people have problems all the time. They struggle with things, and it's okay. There are people there to help you. We want to help you. They're very vulnerable population, and we're there to help them with that.
Okay, well, that is great information. Thanks for coming by
You're
here
welcome.
on the 4 o'clock show.
Thank you for having me. Appreciate it.